Good morning. My name is Bob Hendren. I'm a professor and a child and adolescent psychiatrist here at UCSF. I'm really pleased today to be able to introduce our speaker, Dr. Tracey Woodruff, who is director and Alison Carlson Endowed Professor for PRHE and is professor in the Department of Obstetrics and Gynecology and Reproductive Sciences at the Philip E. Lee Institute for Health Policy Studies. She's also the director of a newly awarded NIEHS Environmental Health Core Center grant, the Environmental Research and Translation for the Health of Earth, big E and small a, Center at UCSF. She's a recognized expert on environmental pollution, exposures, and impacts on health, with a focus on pregnancy, infancy, and childhood, and her innovations in translating and communicating scientific findings for the clinical and policy audiences. She's authored numerous scientific publications and book chapters and has been quoted widely in the press, including USA Today, the San Francisco Chronicle, and the New York Times. Tracey and I came to know each other through our commitment to understanding and preventing environmental contributors to the epigenetic development of neurodevelopmental disorders, which causes me to be especially excited about her presentation today. You can see the title of which is on the screen. I remind you that we'll plan to be on time and stop at 9:20, or Dr. Woodruff will stop at 9:20, and then we're open for questions. You can raise your hand in the place to raise your hand on the box, and I'll see when you raise your hand and call on you. But you can also put questions in the chat box, and I'll try and keep track of those, and the ones that seem to have the most popularity we'll give to Dr. Woodruff, and we'll plan to stop at 9:30. So, Dr. Woodruff, looking forward to your presentation.
Thank you so much, Bob. It's been such a pleasure to know you all these years, and it's great to come back and talk about this important topic. I was going through some of my, and I see Mary Burke on the phone. I've also done grand rounds for them, just looking at what's been going on in this field and how much it's advanced. And I'm just really excited to talk about the what we know right now and what we should know about environmental chemicals and pollution exposure and how it affects the developing brain. And I have nothing to declare. And I just want to take a moment to talk about the Earth Center, because it's a relatively new center on campus. It's a core infrastructure grant from NIEHS, a P30. And the goal of this, and this is why I'm really excited to talk about psychiatry, because it forms a foundation for us to continue to build on relationships that we've already started, but with a little bit more funding and capital in terms of our research. So the goal of the center is to transform how we study harmful pollutants that undermine health and human development and contribute to chronic disease and health inequities. And I'll touch on both those themes in this talk. And what's really exciting about the Earth Center is if people are interested in the talk afterwards, we have a number of different core components that can help support your work in this area, whether it's helping set up a research program. We have pilot grant funding opportunities. We also do our community engagement core works with clinical faculty, and we have a scholars program for both emerging scholars and established scholars to learn more about environmental health. So let's keep that in mind. So I'm going to talk about environmental chemical exposures because they're invisible but everywhere, and then why chemical exposures matter for neurodevelopmental outcomes, and what we're focused on is what are the opportunities for prevention. So I like to start because we have actually known about pollutants that affect the brain for hundreds of years. And this is Ben Franklin, which you might know, is on one of the bills that we spend, but he was also the ambassador to France. And what was very interesting was that he noticed that these people who are working in certain occupations had these kind of dangles or dry grips. They basically were having some type of exposure that was affecting their brain, their neurology. And he noticed that there were different trades, some of them who suffered from this and some who didn't. And the trade that suffered from these pretty severe neurological effects were highly exposed to lead, which he wrote about back at the time. And that was a preview of really further research that came along. And I know you're in the Department of Psychiatry, so you're probably very well familiar with the effects of lead on the developing brain. Lead is now identified as having no safe level of exposure. It can damage the brain and the nervous system, can slow growth and development. Exposures can contribute to learning and behavior problems and hearing and speech problems. And this has been well established for over 50 years. But I think will come up in this talk is that things that we identify at very high exposures as having an effect on the brain, as we continue to study, we can see that the developing brain can be very more acutely sensitive to these exposures, leading to adverse neurodevelopmental effects. I also want to highlight that exposures to these chemicals or pollutants are not uniform across the United States. And lead is a good example of how certain groups of children have much higher exposures. So for example, you can see right here, this is data from CDC looking at lead levels in children. And you can see that Black, non-Hispanic children among all incomes have higher exposures to lead. And it's primarily those that live below the poverty line that have the highest exposures, leading to environmental justice implications. So I wanted to talk first about why we're concerned about exogenous contributions to neurodevelopmental outcomes in children. And one reason I think that has been driving intense interest and concern in this topic area is the increasing rates of neurodevelopmental outcomes in children that are being observed in our population. So this is data from the Childhood Autism Prevalence Network, which you are probably familiar with in the Department of Psychiatry, which works with a network of group centers in different states to look at autism prevalence. And you can see that since they've started in 2000, the prevalence of autism has steadily increased. And I just put this star right here because data just came out last week showing that there's been yet another increase in autism over the last 5 years between 2016 and 2018. Concurrently, we're also seeing an increase in parental reporting of ADHD. This is data that's collected by National Health Interview Survey, and you can see that it's also been increasing over time. I thought was very interesting about this recent report that just came out from the Autism Network is that they now have data on this data here up in this graph is from 8-year-olds. They now have data on 4-year-old children. And what was, I thought, pretty remarkable about this is now that they're seeing that more Black, Hispanic, Asian, or Pacific Islander children had autism compared to white children, and that children born in 2014 were more likely to be identified with autism by the time they were 4 years old compared to children born in 2010. Again, this change over time in these neurodevelopmental conditions that are concerning. So this is why we at the Program Reproductive Health, the Environment, and the Earth Center focus on industrial chemicals in the environment and pollution. And that's because what we're seeing in the United States, which is also true globally, is that there's been an increase in chemical production since the 1950s, which mirror the increase we're seeing in these neurodevelopmental outcomes, which is also just one of a number of other chronic diseases that are also increasing in the population. So these are chemicals that we can find in many and very different types of products that we use or come into contact with every day in our lives, and that start even before conception. So there are perfluorinated chemicals, which are on nonstick applications, flame retardant chemicals, which I'll talk a little bit more as an example of how we understand chemical exposures and how they can be affecting brain development, phthalates and plasticizers, chemicals that are in food contact materials like BPA, which you probably have heard of all of these different chemicals. So exposures to these chemicals can occur throughout the day, as I said, but in all various different routes of exposure. So there is pollution and chemicals in the air that we breathe. There's chemicals in drinking water that we are drinking. There's chemicals that are used on foods and food products or come from food packaging. So we're consuming chemicals every day. And then there's chemicals that are used in consumer products like personal care products, cleaning products, and then many of the materials that are in your built environment. So your rugs, carpets, floors, walls, all these contain different types of chemicals that can migrate out and to which we can become exposed. So, the other thing I want to point out is that these exposures, as I said, can occur at all different life stages. And the exposures are particularly important during these developmental periods because of the profound and unique changes that are occurring during development, such that the exogenous exposures can influence the progress or the pace or the pathways of development that can permanently alter the course of development, leading to an increased risk of various types of adverse outcomes, including neurodevelopmental outcomes. So this is from a study that we did. It's a little bit old, but the data is still, we still are seeing this similar pattern of multiple chemical exposures that occur both in the population and during pregnancy. And as I said, pregnancy is an area that we focus on because of its important susceptible time period for influences from industrial chemical, environmental chemical pollution exposures. So in this study, and it's data that's from the US government collected through the National Health and Nutrition Examination Survey, we found that pregnant women are exposed to at least 43 different chemicals in 99 to 100% of pregnant women across the United States. So there's universal exposure to multiple industrial chemicals, including some of the ones that I talked about in the previous slide. So phthalates, perfluorinated chemicals, some PAHs, and then there's also chemicals that are what we consider legacy chemicals. So chemicals that were produced and ultimately banned in the 70s, so like PCBs, but because of their particular chemical property, they hang around, persist in the environment where we can continue to be exposed decades after they've been used. So the chemical exposures during pregnancy, past the placenta, enter the fetus, and so exposures are occurring in utero as well as after birth. And this is a quote from the National Cancer Institute saying that to a disturbing extent, babies are born pre-polluted. So even, and actually prior to conception, after conception, exposures are occurring in the population. So this is particularly important, as I mentioned, during the prenatal period. In the case of the fetal brain, there's multiple periods of development that are occurring in utero, which I know this audience is familiar with, during the different trimesters, and each of these exposure periods offers an opportunity for changes to the pathways of development that can result in some type of future observable effect in early childhood or later in childhood. So this talk focuses on environmental chemicals. I want to acknowledge that there are other factors that can influence health, including your access to food and nutrition, life experiences, social environment, which I'll talk about in a little bit. Where you live is extremely important because that influences the type of exposures that you have, and then environmental chemicals. And we focus on environmental chemicals for a number of different reasons. One is it's highly understudied in terms of its influence on health, even though the data that we have do indicate that it is an important risk factor for health, including effects on brain development. And it represents a high value opportunity for intervention and prevention, meaning that we can intervene on environmental chemical exposures, reduce those exposures, and thus improve health. And I will give an example of each of these components. I just want to also note that while I talked about vulnerable periods of development, we also have other external or exogenous factors that can also influence health and can create increased risk to neurodevelopmental outcomes or other health outcomes. And this is referred to as, in some, it has different phrases, but here the triple jeopardy of social inequality. And this is from some work from Dr. Rachel Morella-Frosch, who's at UC Berkeley. And that is that we can have biological susceptibility, so factors like life stage or developmental life stage, exposure to environmental chemicals, and these can be an added risk for those who have social vulnerabilities or who live in areas where they have poverty, racism and discrimination, less access to services. These in combination can create an increased risk of an adverse health effect, an adverse neurodevelopmental effect, and can lead to health inequities and environmental justice concerns. So the environment, the other component of our studies on environment is looking to understand how the environment and environmental exposures to chemicals and pollution can contribute to health inequities. So here's an example of a chemical that I'm going to talk about that illustrates the concepts of the exposures to the developmental effects and neurological outcomes. So you may, this is a polar bear sitting on a couch, and you may think, what does these two items have in common? And the thing that they have in common is they're both exposed to this flame retardant chemical called polybrominated diphenyl ethers, or Pvdes for short. And as you probably know, the polar bears don't live anywhere near a couch, but they can both contain Pvdes, and that's because Pvdes are contained in the foam of the couch. They can migrate out, and because of their persistence and ability to bioaccumulate, they can be found globally around the world. So, as I said, so Pvdes are used in foam. They can migrate out into dust. They are found in numerous animals, including cats and dogs. They're also found in the food supply because they also have a particular feature that makes them fat-loving, so they can be found in high-fat foods. And because they can get out and about and they persist in the environment, they've been found in fish, predatory birds, and polar bears, all which do not live near the source of the chemical exposure, and they're found in people. So data at the time that we were, at least in the study that we produced in 2011, showed that there's a universal exposure to Pvdes in the United States. And as I said, they've been used in foam applications. They're used in home insulations and plastic casings, a lot of carpet paddings made from recycled foam. They have been in some baby products that can contain foam. Some of this has changed over time, which I'll talk about why, but they aren't loosely bound. They get out into dust, and then people can be exposed through dust or inhalation. So PVD exposures are not uniform. Even though everyone is exposed to them, they're not uniform across the United States. So there are populations, subpopulations that have potentially higher exposure. So low-income communities and communities of color and children. I'll talk about a little bit about this data, but also people who live in the state of California have higher exposures to these. And the reason for this is because starting in 1975, California had a technical bulletin, and this is I just want to pause here and say this is where looking at these structural systems that are in place are important because they can influence all of our exposures to these different types of environmental chemicals. So this standard, which was put in place in 1975, was a performance standard that was required that foam furniture, so any furniture that had foam in it, have this ability that once you remove the fabric, it could withstand a open flame for 12 seconds, which was a unique standard. Both no other state had it in the United States, and it was unique globally, and it required the use in order to meet the standard of high levels of these flame retardant chemicals. So the result of this standard was that Californians had higher levels of exposure to this chemical. So this is from a study that we published looking at we measured levels of Pvdes in pregnant women mid-gestation recruited from a clinic at UCSF. And I just want to note that in what we found was that California women have the highest levels of Pvdes among pregnant women anywhere in the world. And this was, and while you can see that they had higher levels in pregnant women in Spain, Salinas Valley, the interesting thing is that the women in Salinas were primarily immigrants from Mexico. So being an immigrant from another country, because that country didn't have these high levels, meant that you had lower levels. And then this is across pregnant women in the United States. And as I mentioned, that's one group, is that people who live in California had higher levels. And then low-income communities and communities of color also had documented higher exposures to Pvdes. So this is from a study looking at Pvdes in house dust. You remember, it's in the product, it can migrate out and get in the house dust. This is from a study, this is in California, and this is Pvde levels in house dust in low-income and communities of color. Actually, this is from a collaborative project with participants in the Richmond, California, but also data that we produced from measuring these Pvdes, again in mid-gestation through multiple cycles, showed that Black women had higher levels of Pvde exposures compared to their other counterparts. And I just want to again note that a lot of the Latina women are immigrants, and also it appeared that from this study, which drew from women from all over Northern California, that there were higher levels from women who were from the Central Valley. And finally, children can have higher exposures. So the dust is, if Pvdes are in the foam, it gets into the dust. Children have unique behavior patterns. They're crawling around on the floor. They're putting their hands in their mouth more often. And this is from a study from Rose at UC Davis, where they looked at exposures to Pvdes in adults, children, and then this is an occupational study of people who work directly with foam. And you can see from this that the Pvde levels in children ages 2 to 5 years, so right here, are very similar to occupational exposures in exposed adults. So, and much higher than adults. So there's these confluence of factors that can put certain groups, during development, low income, communities of color at having higher exposures and thus ultimately higher risks for effects from Pvdes. So what are the health effects of Pvdes? Well, Pvdes are, this is the chemical structure of Pvdes, and I show this only because, not to have a chemistry lesson, but that it's very similar to thyroid hormones. So says, we have testimony that you walk like a duck and you quack like a duck. Tell the court, are you a duck? So because there's a structural similarity between Pvdes and thyroid hormones, the thought is that Pvdes can act like a thyroid hormone or interfere with thyroid hormones. And thyroid hormones are extremely important during pregnancy because you have to have sufficient thyroid hormone levels for proper brain development. And so interfering with thyroid hormone levels can increase the risk of neurodevelopmental outcomes in childhood. So indeed, there has been studies showing that PVDEs in humans have can interfere with thyroid hormone levels. There's studies showing in vitro that it can disrupt the developing fetal human brain cells, and in animals, studies have shown it affects learning, memory, and attention. So this is from some work out of Dr. Josh Robinson's lab here at UCSF, and is an area that I would say is growing. He does work to look at identifying risks for developmental neurotoxicity using human embryonic stem cell models of neurogenesis. And this is two congeners of BDE, so BDE 47, BDE 99. And I'm not going to get into too much detail, but you can see that as exposures increase, you can see effects on the embryonic stem cells that are related to neurogenesis. And what he found was that PVDEs affect cytotoxicity and function of these HESC-derived neuroprogenitor cells, and that it happens in a concentration-dependent manner. And then if he looks at gene expression and pathways that have been altered in the neuroprogenitor cells, he finds that there are multiple pathways that can be altered, including thyroid hormone signaling and those related to central nervous system development, as well as some other mechanisms, oxidative stress as being them. So you can see that we have animal data, in vitro data, mechanistic data. And so what does the human data say? And so this is from a systematic review that we conducted on the human epidemiological evidence that existed for looking at prenatal exposures to PVDEs and measurements of effects on neurodevelopment as measured through IQ. And so there's at the time when we did this systematic review, there were 4 studies that have been conducted epidemiologically. These are cohort studies that have been conducted, 3 of them in the United States, 1 of them in Spain, that had looked at the relationship between PVD exposures and measurements of IQ in childhood. And you can see that when we combine, and they're actually also from 3 different places in the United States. So it's New York, Cincinnati, and then California. And you can see when we combine them, along with the one from Spain, that we find a robust relationship between increased exposures to PVDEs and decrements in IQ observed in childhood. It's about a 3.7 change in IQ per 10-fold increase in PVDE exposures. This systematic review was reviewed by the National Academy of Sciences in a report that they did on looking at endocrine disrupting chemicals, and they both concurred with the systematic review and then concluded that PVDEs are a presumed hazard to human intelligence. This also included an evaluation of the animal evidence. So we have good evidence now that PVDEs exposures can increase the risk of IQ in children. So I want to note that the environmental chemicals may have a relatively low, compared to other factors, risk for the individual, but because everybody in the population is exposed, you can have a significant effect on who is impacted because of the number of people exposed, even if the risks are low. So just to illustrate this, and is that if you have an average population like this and you have a bell curve distribution, so some people are at either ends of this distribution, by shifting this curve, even if because you're shifting the whole population, because everybody's exposed, if you shift the whole population, even by, in this case, maybe 5 IQ points, you can significantly increase the number of people who are in intellectually impaired segment, but even who have more subtle neurocognitive effects in childhood that can be measured. So addressing these population-wide level exposures is extremely important because they can have high influences on the overall population's health. So I gave an example of Pvdes, but it's just one of the many chemicals that are produced and used in the United States, which I'll talk a little bit about the extent to which that is. And these neurological disease and disorders associated with environmental chemicals are not just IQ. Many studies measure IQ because it's been done. It's can be implemented, and then it could be compared across studies. So it has some methodological attractiveness. But there's many other factors that can be, or neurodevelopmental outcomes that can be associated, including ADHD, autism, learning disabilities, conduct disorder and behavioral problems, cerebral palsy, impairment, and vision and hearing. So it's a constellation of neurodevelopmental outcomes that can be affected by environmental chemical exposures. And I talked about Pvdes here, which is, and some of the features of why we know the relationship between a chemical exposure and a particular outcome is maybe simply because of the measurement, and we may not have sufficient data to really understand the link between some of these other outcomes, because if you affect one component of the brain, it can be a very multifactorial outcome. And so here's lead, which I talked about very early on, but some of the other chemical groups that have been shown to be associated with these various types of neurological diseases and disorders include methylmercury, PCBs, organophosphate pesticides. I just want to say that we can talk about it in the questions, but this has been, I would say, not well recognized. And then there was a lot of also good cohort epidemiological research on organophosphate pesticides in animal studies. And these have also become more prominent, and some of them have been banned or declared by the state of California as known developmental neurotoxicants. Pvdes, PAHs, arsenic, perchlorate, BPA, and phthalates. So this is a really interesting and important paper because I think it illustrates the issue of widespread exposure and but it combined with small risk compared to higher risk factors but affecting a smaller portion of the population. So this was done by Dr. Bellinger, who's at Harvard, who's a neuropsychiatrist, childhood neuropsychiatrist, and he basically looked at IQ point loss associated with different risk factors in a population of 25 million children. So the idea is to look at the attributable risk for these different risk factors, accounting for the risk and the proportion of the population who could have this risk. And what he found was that medical conditions would affect 34 million IQ points. And so these are things like congenital heart disease, preterm birth, brain tumors, et cetera. And then neurodevelopmental disorders, so like autism, ADHD, and bipolar could influence 38 million IQ points loss. Socioeconomic, nutritional and psychosocial factors, so a failure to thrive and iron deficiency, 15 million IQ points lost. And then environmental chemical exposures was 40 million IQ points lost. So just a couple things that I think are important to note about this. I know the numbers seem exact, and there is uncertainty in the numbers and possibly the conditions that are related to this, and they don't cover all the conditions that could be related to these IQ points lost. But I think the take-home message here is that environmental chemical exposures can be as influential of some of the known risk factors that are commonly identified and addressed in the medical community. So things like neurodevelopmental disorders and medical conditions in preterm birth, and then these socioeconomic and psychosocial factors. So the point being that we should be thinking about chemical exposures as a similar type of risk factor as these other kind of conditions that we treat in clinical settings. So I talked about the rise in the manufacturing and importation of chemicals in the United States. So there are about, oh, these numbers are a little bit old, sorry. This is made before EPA updated their inventory of chemicals. So there's actually, there's about 6,000 to 8,000 chemicals that are manufactured in or imported in what we call high amounts, so greater than 25,000 pounds. There's about 40,000 chemicals that are registered for use or production in the United States. So, but you know, a smaller amount of them are made or used in large quantities. And only about 200, so a very small fraction of these chemicals, so the things that I talked about like Pvdes or phthalates or BPA have been tested for health effects. So while we know some about a small group of chemicals, there is a really large group of chemicals that we have no information on the extent to which exposures are occurring or how they may be influencing health or prenatal development and neurodevelopment. So, and I think this brings up an important component again about the systems by which these, the systems that influence how we are exposed to exogenous agents. So manufactured pharmaceuticals have to have safety data before use. So if you have a patient and you are prescribing a pharmaceutical intervention, that is required by law to go through multiple layers of testing, in vivo, in vitro, in vivo, clinical trials, and then it can be prescribed to your patient. And it has to show safety as well as efficacy. That is not true for the vast majority of manufactured chemicals. The way the law is set up in the United States is that the existing chemicals are out being used, we're exposed to them, and then we're basically doing post-market testing on them in real time without a required set of data having to be given to the EPA for that. And then there's some details on that we can talk about. So now I want to talk about the relationship between the research that we're doing and the interventions that occur at a systemic level and through public policies. So I talked about lead in the beginning, and I just want to note that there was widespread exposure to lead in the population through multiple sources, including the introduction of lead in gasoline, despite concerns at the time based on all the findings about how occupational exposures to lead can affect the brain. And we introduced lead into gasoline, but in the 1920s, it was eventually phased out because of the Clean Air Act in 1973. And you can see that when lead was taken out of gasoline, the lead levels declined in gasoline, and we saw a commensurate decline in blood lead levels in the population. And just going back to, there was a lot of studies showing the relationship between lead and IQ points. And this is data from EPA showing that there was an increase in 5 to 6 IQ points gained among the population, among children in the population, which was an economic gain of $100 to $300 billion. So this had a measurable improvement on the population. So one of the, because of concerns about environmental chemical exposures on neurodevelopment, there has been an organized group under this project called Project Tender, targeting environmental neurodevelopmental risks, which is a consortium of clinicians, public health advocates, and environmental and public health scientists. And they have issued a consensus statement talking about their concerns because of the increasing rates of neurodevelopmental disorders in children and increasing chemical exposures, that they really have a call to action to reduce exposures to toxic chemicals that can contribute to neurodevelopmental disabilities in America's children. And they also agree that there is widespread exposure to toxic chemicals in air, water, and food, and that these can increase risk for cognitive, behavioral, or social impairment, as well as specific neurodevelopmental disorders. And I think this is really important, that this kind of cross-sectoral group of scientists, clinicians, and advocates are coming together to address this problem. In addition, there are clinical groups who've also identified and been more engaged on the role of environmental chemical exposures and their influence on development, influence on conception, development, and the increased future risk of chronic diseases in child and adulthood. And this is a statement from the International Federation of Gynecology and Obstetricians. This represents thousands of women's healthcare professionals globally from over 120 countries. And they've also noted that exposure to toxic chemicals during pregnancy is ubiquitous and a threat to health and human reproduction. They also cite the Tender Statement, and that even small exposures to toxic chemicals during pregnancy can trigger adverse health consequences. Oops, that's way. I also want to bring back this, again, the theme that the exposures are unequally distributed. The ACOG and the ASRM committee opinion, as well as have also issued an opinion on a consensus statement about environmental chemical exposures. And they've also, both this and the FIGO statement talk about the fact that underserved and communities of color have higher exposures, which is a part of environmental racism and a component of environmental justice. And also, people in the workplace can have higher exposures as well, which putting them at higher risk for these adverse health outcomes. So we have, as part of the work that we've done as PRE and the Earth Center and collaborations with our clinical partners, have developed some tools to help clinicians talk with their participants or their patients about individual ways that they can reduce chemical exposures. And some of them are overlapping with the kinds of recommendations you would give to patients anyway, which is eating lower on the food chain. So a lot of these chemicals migrate into fat, and organic foods when possible. Studies show that organic food consumption is associated with reduced levels of organophosphate pesticide exposure. Avoid eating fish high in mercury or PCBs. These are also linked to neurodevelopmental outcomes. Avoid eating and drinking and storing of food in plastics, microwaving in plastics, and avoiding consumer products. Not everything that people do is necessary or is very expensive. For example, something like removing your shoes before you enter your home can help reduce tractant exposures. But I want to note that an important component of our recommendations and the work that we do with our clinical partners, including those in Project Tender and ACOG and FIGO, is to note that it's really also important for the clinical community to advocate for policies or systemic changes to prevent exposures to toxic environmental chemicals. And this is why. And that is because individual action is not enough to reduce these exposures. I have this example here, but just going back to lead in gasoline, if you did not want to be exposed or have your child exposed to lead from gasoline, from lead in air that came from gasoline, there wasn't anything you could do about it because you couldn't control the fact that everyone was putting leaded gasoline in their cars. And it's similar with many of these other types of environmental pollutants. in that, and this is an example from a woman who more recently participated in a study doing biomonitoring, and she was taking the advice that we give to many of our patients, including eat organic, avoid BPA, buy natural cleaners, but she still had measurable levels of many of these chemicals that we know are associated with neurodevelopmental outcomes, as well as other ones, including mercury and phthalates. So again, while we can do something individually, we really need systemic change to address the sources of these exposures. So this is the recommendations from FIGO, which is that they recommend that clinicians advocate for policies to prevent exposure to toxic environmental chemicals, work to ensure a healthy food system, make environmental health part of healthcare, and champion environmental justice. So here's what happened with Pvdes. So talked about Pvdes being widespread exposures, higher exposures in California due to the regulatory standard put in place in 1975. And there was, in part due to from biomonitoring and measurements showing that PVDE levels were going up and concerns that they looked very similar to PCBs that had been banned, there was a phase out that happened nationally. But in California, California banned PVDEs in 2006. And you can see, and this is again from the studies that we were doing of pregnant women recruited at UCSF clinics, that after the ban between 2008 and 2009 and 2011 and 2012, we saw a decrease in the levels of PVDEs in pregnant women, meaning that similar to what we saw with lead, after there was a systemic change, the state of California banned PVDEs, there was a decrease in exposures in the population. So thus, and actually now, if you look nationally, because of the phase out nationally, there's been PVDEs have been continuing to decline in the population, which is a success story. But in 2006, we still had that 1975 regulatory standard. So while they banned PVDEs, because they still had the standard requiring that you had to use chemicals for the flammability standard, basically manufacturers took out the PVDEs, but they replaced them with other types of flame retardant chemicals, including these organophosphate flame retardant chemicals. So you basically didn't solve the actual underlying problem of these flame retardant chemicals. And I just will note, there were a lot of studies also being done at the same time showing that the flame retardant chemicals did not really produce their intended function, which is they didn't actually have that important an influence on reduction of fire deaths. So here's what happened after that. So at San Francisco, realizing that they were in this whack-a-mole situation, they banned all flame retardant chemicals in furniture. And I just want to say, here's the study that I talked about, the systematic review of PVDEs and IQ. You can see it was on the front page of the Chronicle, kids with low IQ linked to anti-fire chemicals. And then so this is Dr. Mina Singla, who was working in our program at the time. And here she is testifying before the San Francisco City Council, or the Board of Supervisors, with Dr. Marius Latnick, so working in partnership with our clinical partners, along with other advocates who had been working on this issue, testifying on the San Francisco ordinance. And San Francisco passed the ordinance. They banned the sale of upholstered furniture containing flame retardant chemicals. And then this went up to the state of California. And in 2018, the governor of California signed legislation that banned toxic flame retardant chemicals, took away the 1975 standard and replaced it with a different type of performance standard. And so California went from really a laggard to a leader on this in this area. So I just want to end with, again, going back to the lead story. People know lead continues to plague communities across the United States. And I think this was well illustrated in the Flint, Michigan crisis, where residents in Flint, Michigan were exposed to extraordinarily high levels of lead in their drinking water due to changes that happened in the drinking water supply. And Dr. Mona Hanna-Attisha, who is a pediatrician in the Flint community, became quite well known because she helped to uncover the Flint lead crisis. And I think this is very inspiring because she was a pediatrician. She was working with her patients at the time, and she uncovered that there were these really high levels of lead in the children, and she worked with other advocates to really push for change in Flint, Michigan. And I just want to note that she's gone on to talk about the other factors that can together influence children's health and neurodevelopment, which is also about healthy communities. And I love this article that she wrote in the New York Times titled, "I'm sick of asking children to be resilient," because that is really putting the onus on our children, on our patients, on the population to address an issue that is really about the systems and the ecosystems and the social environment and the environmental environment from which we live that are really driven by public policies. And I'm just going to end with her quote, which is, "Rather than hoping a child is tough enough to endure the insurmountable, we must build resilient places, healthier, safer, more nurturing and just, where all children can thrive. This is where prevention and healing begin." And with that, I'd like to thank all of our amazing staff in the program on reproductive health and the environment and our funders. And you can follow us on our various social media channels. So thank you.
Thank you, Dr. Woodruff, for that excellent presentation. It was comprehensive, colorful. It was it really showed things very well. We have one question in the chat box. I don't see any hands raised, but the question in the chat box had to do on the toxic chemicals in pregnancy handout. Are the interventions rankable by risk reduction effectiveness? And then kind of what does each contribute to the intervention?
Yeah, that's a good question. So I would say that the evidentiary base on the various interventions, the individual level interventions, are kind of on a continuum. So like mentioned that for the organophosphate pesticide exposures, there's actually been a systematic review showing that if you switch to an organic diet, you can reduce your levels of organophosphate pesticide levels. And then a lot of those studies have been done in children. But some of the other interventions, for example, the don't microwave in plastic, is really based on a kind of our understanding about what kind of chemicals are used in plastic, the fact that we know that heating plastic can agitate those chemicals and create more leaching, and that we know that there's a lot of, we can actually, exposure to some of these chemicals is highest in food. And so, but there hasn't been, so those all are important components of that. And that leads us to recommend that, because it's pretty easy not to microwave in plastic, you can put it in ceramic or glass or something like that. And so then in that way, there's not been an intervention study of the microwaving in plastic per se, but we know that that's just an easy way for people to do something that we hypothesize is very likely to reduce their exposures. And so each of them have a range of evidentiary base on that. And so we don't really rank them. I know what people really want to know. We got 10 though. We got it down to 10.
No, I had wondered too, if there was anything about protective factors or things like
yes,
vitamins, vitamin
yes,
D or
yes,
folic acid or anything
right.
Like that.
Let me just say there's been studies on it's the issue about, I just talk about this in relationship to autism. That has been a very difficult issue too, because people hypothesize that there's environmental exposures chemical or pollution exposures that contribute to autism, but the studies have not been very illuminating in this area, except for in air pollution. And but studies have shown that taking folic acid during pregnancy can reduce your risk of autism. And so that's one thing. And then I just want to talk about the healthy diet component. So the effects of lead can be ameliorated with, a healthy diet. So that's one also area. So I agree with you. There's components about the diet that can be helpful to ameliorate effects of chemical exposures. But I want to also say I didn't talk about this in the talk, but we've done some work showing that another reason to have a healthy diet is a lot of chemicals are in packaged and processed foods. So if you eat a lot of takeout food, right, from fast food restaurants, you can have a lot higher exposures to chemicals like phthalates. And so again, there's just like a lot of evidence indicating that a focus on more home, things that are prepared in the home, lower on the food chain is going to ultimately reduce exposure. So clearly we should get them out of the food supply. It would be helpful too.
Thanks. We also can take questions if people raise their hand in the reactions box, but I'm going to keep going through the chat box. Tony Yang asked if there was a place where a website that they could refer to look up the latest news and data on harmful chemicals that they can refer patients to.
Yes, I'm going to say we have some of this information on our website, but we're in the middle of upgrading it. So you could go to the website. There's information in there for clinicians. It has links to all the materials that we give out to pregnant patients that we see in our studies. And I believe it's given out to all the pregnant patients at UCSF clinics. But I will also posit that we are in the process of upgrading the website and the materials. So some of the materials, they're still useful and the same, but they're dated in terms of how they look. So
a quick question was, do non-iron clothes contain toxic chemicals? Maybe that's not a quick question.
Yeah, I think some of them, I'm not a super expert, it just is like casual reading. There is chemicals that are used in some of those. And I've seen something about how formaldehyde is possibly in some of those, those press-free products, as well as maybe nanomaterials. So I think I just would say one of the challenges in trying to figure this out is because when you go to the store, right, and you see, I have to iron this, it's so great. But that manufacturers are not required to tell you when you're at the store for most things what's in that item, right? That is making it like that. So in some ways, we're constantly, as environmental health scientists, playing detective to try and figure this out. It's required for cosmetics and food, right? Because you get your food and it tells you the calorie content and fat and type of fat and all the different things used in the food. But for a lot of these products, we really have no idea what they're using. And so that makes it difficult. But so yes, I think they're using something. I'm not totally sure they're being used, but those are some of the things I've read about.
Dr. Mary Burke asked about ideas for clinicians that might be able to have then developmentally appropriate enrichment that could reduce the negative impacts of things like lead.
I think there is also studies that show that children who have higher lead exposures but live in a more enriched environment, the effects can be ameliorated and reduced. And so yes, that can happen, but I think that again speaks to the issue about while it's really important for children who have high lead levels as thinking about interventions, but also thinking about in the future to create, again, the sustainable communities where, you have more opportunities for that systemically rather than trying to deal with it on a case-by-case basis.
I'm trying to think of one last question in the 1 minute that we have left. That is, silicone also a safe alternative to plastics for food preparation, cooking?
Yeah, I have to say I've been thinking. I think that it has a different suite of chemicals in it. Obviously, I'm not that. I have been thinking about that, but I'm not that. I haven't seen a lot myself written on the composition of it and the opportunities for what types of chemicals to migrate out. I will say that there are other silicone-based applications like siloxanes that are used in personal care products, which are they have a similar type of chemical features. And there has been some concern about possible reproductive effects and that they're persistent in the environment, but I'm not that totally. We haven't done anything on the silicone cookware. I've not seen a lot on that, but some of the people we recommend, like Environmental Working Group, have a lot more consumer-oriented information about chemicals in various products, and they may have something about this.
Thanks again for your illuminating and crusading work in this area. It must be a challenge at times. The fight that you have, and it must feel a rewarding fight as well, as you know you're doing good in the world. And so thank you for sharing that with us here in the
Well, thank you. Thank you for inviting me. And we're always looking for, if people are interested, remember the Earth Center, you can email us, collaborate, follow us. We're continuing to invest in helping all the various people at UCSF add an environmental component to their work at every step, from the research to the clinical to the policy engagement.
Great to be with you. Thanks, everyone. Bye.